Why do young people fall sick? Is it because of their lifestyle? Is it because of their nutrition? Is it because of habits? Or is it because of pressing their phone, like your Nigerian mother would always accuse you of? These and many more is what we'll be discussing about on today's episode of Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. My name is Amazing Rita, and I'm in the studio with Dr. Dimba Favor. Hi, Dr. Favor.
Hello, Rita.
How have you been?
I've been good. What of you?
I'm all right. Okay, so we want to discuss the reason why young people they fall sick. We normally in, should I say Nigeria? Let me just say Nigeria. We believe that your youth is supposed to be accompanied or crowned with good health. That's why you see when you're in the hospital and then you see somebody like probably somebody of 20 years, 21 years having kidney failure. And everybody's like, is he not too young? That kind of thing. Because they expect that as you're young, your system is supposed to be strong to fight whatever it is. So, but that is not the case sometimes. We find young people with terminal diseases. We find young people with sicknesses that and some of them would even say that they didn't know, like they feel they are not with the way they have been keeping their health on check. They are not supposed to get, how would I put
Have those illnesses.
have those illnesses you get.
Okay.
So we want to understand, so that not just me, you, other young persons watching, they can understand why sometimes young people they fall sick, especially the ones that fall sick repeatedly. Yes. So please tell us, Dr. Favor, medically, from your own point of view, as you they see them, why do young people fall sick?
I would say young people fall sick from various reasons, like habits, lifestyle. Yes, you see a young person is already consuming, just like you said in your introduction. It's expected as a young person, the person should be full of life, should have the immunity should be up and doing. It should be like very efficient and very effective. But then things like lifestyle or habits, you see a lot of young people, what they consume, their diets, like they form it as a habit to eat more of processed things than natural things. You see people going for a lot of shawarma, pizza, burger, suya, and what have you, rather than eating natural food,
healthy food.
Yes, that could be a point of view from my own angle. Another thing you can think of is after consuming all these things, they don't burn them out. Majority of people now, they want to make money the fast way. And when I talk of making money the fast way, our minds all go somewhere to the very obvious Yahoo and what have you. So you see most of them just on their phones throughout the day. They're consuming a lot of processed foods, but they're not burning them out.
Sedentary lifestyle.
Exactly. And then because of the curse to make quick money, they don't even remember to exercise. Exercise could be another way. Even if you're not going to work, you're not taking short walks, exercising could be another way of burning these things you consume. But then because they want to maximize their time on the system, they end up not even remembering to exercise. Some of these diseases they have, some of them have, they are genetic, they are inherited, they are hereditary. So some of them are born with it. Others have low immunity. Some are immunocompromised for one or two reasons, like cancer patients, people who are already on chemotherapy, some people who are sickle cell disease patients, some people who are on long-term use of steroids due to one reason or the other. So you can see these people already have low immunity. So it's irrespective of age, whether they are old or young, based on these facts, these reasons, you see their immunity is already compromised. So any little thing, they come down with sickness. Yes. So some other people, this sickness now you're talking about is not streamlined to a particular one. It's across border. So some people, just like I said, they has to make quick money, they expose themselves to a lot of screen time. This could also impact health. So these are some reasons why it's seeming like young people now are falling very sick frequently.
Okay, so tell me, what are some common health problems that before you used to see it or accompany it with probably older
Old
people. Then we see now young adults and young adults and very young people, youths,
teenagers
yes,
coming
coming
down
down
with
with it.
some of them. I would say, like now, the kidney disease. Just like in your introduction, you said you see 21-year-old having CKD, chronic kidney disease, and everybody is wondering, this person is very young now. Why is the person falling ill like this? Or why is the person even having chronic kidney disease? So, like I said, chronic kidney disease is one of these diseases you can see young people now having. And it boils down to what I said earlier, lifestyle. You see a lot of young people want to take a lot of alcohol, little, like excessive consumption of alcohol, little body pain or something, they want to take analgesics. Some of them are already hypertensive, probably because they're on the big side or they have family history of hypertension, and then they don't they don't check or control their blood pressure. Another thing you can see is hypertension. Like I said, one of the reasons why young people now have a lot of illnesses, some of them are inherited. So hypertension is another of these diseases that you can see. It's really affecting young people now. That one could be as a reason of hereditary or even the sedentary lifestyle. Another thing, you could see some sexually transmitted infections, HIV, hepatitis C, hepatitis B, and this is also I'll say it's boiling down to the lifestyle I talked about. People just want to explore, they don't want to wait to do the right thing, and all of this. Another, even some mental health issues. Yes, you could see some people, depression. You could see substance abuse. So these are, like I said, it's not streamlined to one area. It's now widespread. It's going across border. You could even see things like maternal mortality, and that's because teenage girls are getting pregnant, and then in the course of the pregnancy, some of them will want to abort, and then this abortion could lead to bleeding to death. Some of them, due to the fact that their system is not advanced enough to carry this pregnancy, they end up having one complication or the other that could tilt them to maternal hemorrhage, which is a source of maternal mortality. So these are some diseases. Like I said, it's not limited to one area, is across border, widespread. So if we were to talk about them, there are a lot.
Okay. You said something. You said that because of the quest to make it, everybody wants to be a baller right now. It's either you're a baller or you're a baddie. It's now putting so much our responsibility and so much on the young adults. I believe that this is one of the reasons why young people now, you see them, they are so stressed. You see a very young person and the person cannot even stand, like probably stand for 30 minutes. Let's not even go for 10 minutes, 15 minutes, they are tired. Because why? Their body is all broken down, stress has eaten so deep. So I want to know, how does stress actually affect the immune system when it comes to young adults?
I would say for stress, in our previous sessions, we always talk about stress and its relationship to either hypertension, kidney disease. Like I know we've linked stress to a lot of things, but now in this scenario, when someone is excessively stressed, our stress hormone cortisol will be released, and when cortisol is released, it has the tendency of, first of all, when cortisol is released excessively, it has the chronic release of cortisol has the tendency of causing inflammation. One, and inflammation has different ways it can affect the body generally. Another way stress can come in, when someone is stressed, it causes excessive release of cortisol. Cortisol is either transformed to testosterone. That's why some people who are excessively stressed, you see them coming down with tilting towards having symptoms of PCOS. exactly, because it will be converted to testosterone, and then this will now suppress estrogen. Normally, everybody, we all have testosterone, but females have it in
Very little.
minimum quantity, while males have it in high quantity. Yes, but due to excess stress, the estrogen will now be suppressed. So, and then it will cause, because of the increased androgen level, it will now cause suppression of ovulation and what have you. So, stress is like, it has always been a factor linked to different things, including the hypertension I talked about. So, when someone is stressed, you would see that it can predispose this person to risk of having these diseases.
Okay, another issue I would also say is affecting them is lack of sleep.
Okay.
Like there's something I saw on the internet, and they said these days you don't get up and text somebody, "Are you up?" You just tell them what you just tell them what you want to tell them,
As in,
because
like,
they are always
sleep.
active.
Exactly, they're always awake.
So how does lack of sleep actually compromise the health of young people?
Okay, when someone is lacking sleep, even your body tends to give you signal that you're going down. Normally, you can't even, how do I put it now? You can't deny nature. Yes, when the body is sleep deprived, the body on its own starts to give you a signal that you need to rest, you need to rest. And by the time you consecutively disobey, or you don't respond to that signal your body is giving you, you tend to break down. So lack of sleep is one of the contributors of stress. Because when someone is stressed, they'll tell you, some of the remedy, or one of the remedy they'll tell you is go and sleep. Some patients that even come to the hospital, part of their management is
Bed
absolute
rest.
bed rest. So when someone is lacking sleep, the body even gives signals to tell you that you need to go and sleep. So sleep on its own has a way of contributing to stress, and then stress translating to all what we discussed previously.
So let's move to nutrition.
All right.
Malnutrition, skipping a meal, just eating junks.
Yeah.
Like some people, for them to bring that time and probably make a good meal for themselves is a very big problem. And then you see, these days the pizza is very expensive. Yes, because of the high rate of order.
Exactly.
That's why pizza is now very
Very
very, very
expensive.
expensive. So they skip meal. They look for easy, fast meal,
Very fast food.
very fast food, and the
Yeah.
rest. So for those that don't know, can you please educate us how the skipping of meal and not eating good food can actually compromise the immune system?
Yeah, I can. Okay, when you don't have good diet, like we've always said, processed foods, canned foods, they have they are high risk factors for a lot of diseases. And then secondly, fruits, vegetables are good, like they are good food sources that help improve your immunity. Yes, because some of them contain some antioxidants which are very important in your body. So by the time you continue, okay, just like we all see, most of us see, even online and everywhere, even the hot dog, the sausage, most of us like, it's highly cancerous. So consuming a lot of these things only puts the person at more risk of having some of these diseases. Because first of all, they'll be lacking fruits and vegetables, and these fruits and vegetables you can get a lot of vitamins, minerals, even antioxidants from them. So by the time you continuously consume processed foods and what have you, it even tilts the person to more sedentary life, because by the time you consume a lot of these things, there are no antioxidants to help you break oxidative, to help you manage oxidative stress. That's one. Secondly, these vitamins and minerals, the person would have mineral deficiency, vitamin deficiency. And some people that are strict vegans, like they don't consume animal products, and then you see them going for a lot of junks. Most people who are strict vegans, they actually recommend supplements that can be source of these animal products that they lack. Yes, but these people now who are strict vegans, and then they just want to consume a lot of junks, they will not be getting these supplements that are needed. So, and even in our previous discussions, we've seen how processed foods, a lot of red meats, canned foods, how they can actually tilt someone to obesity, and
Yes.
obesity is equally a
Yeah.
risk factor for a lot of
Of
things.
things. So is it like would you say that another reason why young people fall sick easily is because they ignore symptom? Because like I said,
Yeah.
some people will say I'm too young for that kind of
For
thing.
this thing.
You are seeing your body give you signs, but you are living in denial because you
Yeah.
believe you're not supposed to be suffering
From this illness.
at this age. So most young people guilty of ignoring symptoms.
Yeah, it happens. Just like, I know there's one of our sessions we've handled headaches.
Yes.
Some people will be having headache and then they don't want to know the actual cause. Headache is just like a symptom that is connected to a lot of illnesses. Not like when you see headache now, you tag it a particular thing. A lot of things can cause headache. But some people, like now, young people, they would have headache and just ignore it. Maybe they will just say, let me take paracetamol and I will be fine. And even when they've taken the paracetamol and then the headache is persisting, they won't want to seek further health care or medical attention to know the cause
Because
of
of
this
the
headache.
headache.
That way, it's giving you a sign, but you're
Ignoring
ignoring
it.
it. So I'm just using headache as an
Yes.
instance. Some young people they have these early signs, but then they tend to ignore it. Some people will even have sore throat. Let me give another instance. Sore throat now, or a skin rash.
Yes.
And then they just feel, okay, let me go to the pharmacist or the chemist or over the counter, get something like a topical agent that I can just apply on the rash, and maybe the rash disappears and they feel that is all. But then now, something like that skin rash could be a risk factor for the kidney affectation.
Okay.
So young people see some of these signs and then they just ignore it.
Yeah.
They just feel like, okay, let me just get over the counter medications, take, and then I'm
solve it.
fine. And even sometimes the symptoms still persist, telling them
Persist.
something is wrong, but then they ignore it. They only present to the hospital when it has brought them down completely.
Okay. Another thing, as young people,
Yeah.
I want to talk about the importance of doing checkup.
Okay.
Because I believe that there are some basic, or should I say vital tests that a young person should know their status about, like example your kidney function. But some people don't know how well or how good their kidney is functioning because they've not had a problem that will push them to
go and do the kidney function
to go and do the kidney function test. So while you talk about the importance of checkup, you can actually also help with some of the vital tests you feel
You should
yes.
do regularly or
Yeah.
often. Like you said, with your viral statuses. That's the
Okay.
HIV, the hepatitis B, the hepatitis C. Irrespective of whether you live a promiscuous life or not, it's important you do those investigations. The reason is this: many guys, young guys, they go to the barber shop.
Yes.
That could be a route of transmission, transmitting the hepatitis virus, even the HIV virus. Yes, many people go to have their haircuts. Many people give their nails to people to cut. Or to treat, do pedicure and
For
the
them.
rest. So exposure to these instruments without sterilization could be a risk. Then, apart from serology investigations, like you said, the liver function test, the kidney function test, and then for young teenage adults, females, cervical screening, that's the pap smear. These are some things we should do regularly. Yes, because they just help keep us in check. Our blood pressure, our blood glucose as well. These are just little tests here and there that help keep our health intact.
Okay, so before we go,
Okay.
what are some of the ways young persons can actually balance their lifestyle, balance work, balance rest, balance eating well? I believe that some people do not do it
Intentionally.
So-
Possibly maybe they are hooked up with work or other activities that keep them from doing the right thing.
I've actually been in a situation where I come back from work tired and I have to choose between eating and sleeping. I cannot do both.
So you just have to choose your
I have
food.
to choose one, and I sleep. So how can they balance it all?
Okay, I think a way to balance it, from what I think, is just planning properly.
Okay.
Yes, planning properly. These days we have advanced technology where you could get a fridge. I know, like, things are not so rosy, the economy is not so friendly, it's not smiling, but then you could just plan yourself, maybe make a budget. This month I want to get a fridge, and a fridge will go a long way in helping you. When you could, maybe during your weekdays or weekends off, you could decide to, exactly, you could decide
Stock it
to
up.
stock your fridge up, not just with junks, but then with cooked food,
Yes.
good food. You can equally supplement with fruits. You can always get fruits everywhere, and then a lot of water. Water is very, very, very important. Then once in a while, even if you feel you don't have time, or your work is choking, or there's a lot of activities keeping you busy, you can decide today, I'm not going to take a ride home for the full trip. You can decide to divide the journey into two, and then walk for a part of the journey. That way you're equally keeping fit. If you will not be able to go to the gym or exercise regularly, you can. Some people, you could also make a routine. When I wake up, I say my prayers. I'll just decide to skip for 30 minutes. You're also building yourself.
Okay.
Yeah, so I feel these are some ways. And then, like I said, proper hydration, drinking a lot of water, clean water, it would help you. These are some ways you can equally balance it.
Thank you so much, Dr. Favor. So I believe that for those that are trying to balance things up, this, what she just said now, is one of the ways that you can help yourself to balance your lifestyle, because it's important. All the money that you are gathering right now,
If there's no life,
that
money will not be
if there's
used.
life and there's no good health,
Exactly, you would want the money.
you will want the
managing
money on
health,
managing your health.
of which you're not so sure, because it depends on when the person presents to the hospital.
Yes.
If the person presents very bad, the doctors, they're not miracle
I'm
workers.
telling you.
They'll just do their best. So I feel it's very important we take care of our
Take care of
health.
yourself.
And then also, I forgot to add, like, peer pressure, peer influence. So, like, most young people get carried away by their peers.
Yes.
Not because they don't know that this is wrong for my health, but because they just want to meet up with societal
This is what
values.
my peers are doing.
Like, this is what the society
Make I
is
follow up.
vouching for.
Yes.
But just know yourself. I think that's the most important step. Knowing yourself, knowing what is good for you, and then you should not let yourself be influenced by the public negatively. If it's a positive influence, yes, I always vouch for it.
Yes.
But if it's a negative influence, and then equally, the long time on screen, it has effect on the eye and all of those. So hard work pays, and then we should equally learn to balance.
Even when talking about this peer pressure, you can probably have an hereditary disease, and you're trying to compete with somebody that his bloodline is clean.
Exactly.
So you will get there faster before them.
Exactly.
So let's try and balance it up. And if you feel your health is compromised, don't wait till you break down. Today is a very good day to make a decision to go and do your checkup, see a doctor. Over-the-counter medication has never helped anybody. It will just minimize it, and what is going on is still going on in your body. So please take care of yourself. We are tired. Personally, I'm tired of seeing young people die, with lives wasted, dreams gone, and everything. So, but please, a healthier you is a better you. At least I want to see you become the president of Nigeria someday, than your life cut short like that. So thank you so much for hanging around with us on Health Unplugged. My name is Amazing Rita.
I'm Dr. Dimba Favor.
So till we come your way another time, do well to like, follow, share. You can drop a comment if you have any question, and we'll be happy to clear your doubts. Thank you so much for hanging with us. We'll see you in our next episode. Bye.
Bye.